Hello, welcome to Season 2, Episode 2 of A Story Club, Global Politics and Cultures, brought to you by Bulletproof Podcast Formula. This is a unique venture, streaming simultaneously from Trinidad and Tobago in the Caribbean, Dehra Dun in India, and San Francisco in the United States. We speak with people around the world, trying to understand different issues and problems relevant to my own country, Trinidad and Tobago, but also to people in sometimes very similar, but sometimes very different situations, different cultures, histories, politics, sociology, etc. The goal is to learn from each other, to build networks, to widen our perspectives, and to work for solutions in our own distinctive contexts. Today's episode is titled Building Global and National Health Infrastructure in the Wake of COVID. I start off with a quote. The only way that the prolonged COVID-19 pandemic can be stopped is by rethinking the solution. We must have modern healthcare systems in every country. This means infrastructure for public health and for medical care delivery at modern standards to all populations. One model for this is the US Hills-Burton Act, which is a Hospital Survey and Construction Act of 1946, whose principle was to state how many hospital beds per 1,000 residents must be in each locality. At the time, it was 4.5, and deploy accordingly to build them, including modern equipment and staff. Look at instances of our ability to do this today. The 1,000-bed Huoshenshan Hospital was built in 12 days in Wuhan in 2020. In the US, multiple field hospitals were built in record time last spring by the US Army Corps of Engineers. We must do this simultaneously around the world. This means that all countries must work together to accomplish this. We must put aside tensions and conflicts for the time being. There are new strains of SARS-CoV-2 that are showing up, that are more aggressive and more transmissible. These can make vaccines obsolete. Thus, our response to the pandemic, seen in these terms, is a question of existential importance to the human species. It requires cooperation of all major industrialized nations, end quote. That was a quote from a statement by the Committee for the Coincidence of Opposites for the Global Health Summit in Rome, May 21st, 2021, just a couple of days ago, last week. And it was also sent out for general circulation. And we will be discussing this in more depth in today's episode. Today, I am so pleased and honored to have as our guests Dr. Joyce Elders, one of the initiators of this committee of the Coincidence of Opposites. She's also a former US Surgeon General, the first African-American and the second woman to hold that post, serving under Bill Clinton. And she's a professor emerita of pediatrics at the University of Arkansas for medical sciences and a pediatrician. Welcome, Dr. Elders.
A pleasure to be here and pleasure to join this distinguished crowd and discuss some of the things we're doing and that we need to do. So it's a real
great to have you here. Our other guest is Dr. Tim Gopi Singh, former cabinet minister in the government of Trinidad and Tobago, former clinical dean of the Faculty of Medical Sciences at the University of the West Indies, and a gynecologic oncologist. Welcome, Dr. Gopi Singh.
Thank you very much, Kirk, and it's a pleasure and a privilege to be in such distinguished company at this time. And I'm very happy to be here with you and the team.
We are glad to have you. And finally, we have Marcia Mary Baker, the economics co-editor of the Executive Intelligence Review News Service and also a co-author of the statement which I just read from. Welcome, Marcia.
Thank you. I'm very glad to be among you. I'm speaking to you from near Washington, D.C. in Virginia, and I'm most interested to hear about what's going to be said.
Well, thanks very much. Well, to start off, before we even jump into the meat of it, I think a little bit more of an introduction would be helpful, especially since there are just some amazing stories, personal stories each of you had. But I'd like to start off with Dr. Joyce and Elder to please let us know, a bit more about your background and your interest in medicine and health, and how politics fits into this in your trajectory. Can you start, Dr. Elders?
When I start thinking about my background, you see, my background would be very unusual in that I grew up in a very small town of 98 people, farm community. I never saw a doctor until I started college at Philander Smith College. And people often ask me, did I always want to be a doctor and do certain things? But I remind them that you can't be what you can't see. And see, I was born during the time when we didn't have, talk about Zoom. I was born in the time we we barely had radio. We didn't have television. You see, I'm back. I was born in the 30s, so we're talking about we didn't have television. And out in the country, we didn't have it until much later. So I know about being rural. I know about being very poor. I know about suffering and I know about the lack of the kind of quality health care that we need, and about hunger. So I've experienced most of the things that we talk about regard to social determinants of health. And we know that the social determinants are sometimes much greater than the doctoring. And
just to interject, I remember seeing in one of your interviews, you were saying, well, it's in Arkansas you're from, right? And the town you're from wasn't even on the map, right?
It's population 99, 98 when I'm in Little Rock. So I understand rural.
Yes.
And I understand lack of transportation. I understand water. We didn't have running water. And so, and it was late before we even got electricity. We didn't have electricity. We had kerosene lamp lights. So when we talk about all of the problems that go along to go to make up health, and those are the social determinants of health are all critical in order to, if we want to deal with the problems of health across the country. And I remember when they had the Hill-Burton Act, and we were talking, now, we're able to do medicine much more sophisticated, and we don't need as many, we need modern hospitals. We've got better and more facilities where we don't necessarily need as many beds as we used to use, because we don't keep people in the hospital for that long. We know we can treat them better. We have better medications to cure them better, so things go better.
And how did politics? How did you get involved in politics? Because your path in medicine is very interesting and path breaking and whatnot. And then and it was a totally new thing for you, as you said. And then politics must have been another aspect of that. How did that happen?
I think you're absolutely right. Politics was very different. I had to go to college and medical school, and then and I was in basic lab research. So that was a kind of and then I was asked to be the director of the Department of Health for the state of Arkansas, and I really that was when I really went out in the country and truly learned public health before I knew from all my experiences.
Is that while Bill Clinton was governor?
While Bill Clinton was governor.
Right, okay.
Now, Bill Clinton was governor, so I went all over the 75 counties of Arkansas, and I saw what was going on. And every night I would just go home being depressed and dealing and seeing the problems that was going on in Arkansas, and feeling, well, we've got to do something about it, and thinking about the things that we could do and that we had to do in order to make a difference. And so a big thing I really was involved in the beginning was teenage pregnancy. And I said, we can't keep having children grow up poor, ignorant, and slaves. And we've got to do, and I talked about outlining the program. this is what we've got to, this is where we've got to start. So
Right.
that's
And then when Bill Clinton became president, he brought you in as
as a Surgeon General.
Surgeon General. Right. Excellent.
Well, I've
Excellent.
been his health director for 6 years.
Right. Very good. Fascinating. And how about you, Dr. Gopi Singh? Your story may not be all that different, if I understand correctly.
Yeah, I was born in the late 40s, and I shared Dr. Elder's, part of Dr. Elder's social pathway. I was the last of my mother's. She had 13 pregnancies, but I was the 8th one that remained alive. I was the last. I grew up in very humble beginnings. My father was a cutlassman in a company, a work company, and he would do laborious work to earn his livelihood. My mother was at home. My mother could not read nor write. She was a functional illiterate, but she could have checked money to try and educate her children.
Mm-hmm.
I'm having some little difficulties.
Okay.
Yeah.
We can still hear you. So you can continue.
Right, okay.
Good. The video's back.
Yeah, and my mother vowed that I must be a doctor one day. In the Hindi language, you must be a doctor, beta. Those were words.
Mm-hmm.
So I got educated through the primary school system, then to Naparima College in San Fernando. Repeated A-levels to see whether I could get a scholarship, and worked for 3 years before going to University of the West Indies to do medicine. Played a lot of cricket during that time, played national cricket. I represented Trinidad on 2 occasions, represented Jamaica in cricket, came back. And I wanted to do sports medicine because I was involved. But when we had to open the Mount Hope Women's Hospital, Mr. Kamaluddin Mohammed was the minister. He asked Simon Narayan Singh, who was our professor, to go to Mount Hope, but he did not have a team. So we 3 of us went up to England to train at the Institute of Obstetrics and Gynae.
Actually, can I just interject here? So
Mhm.
the Mount Hope Hospital, for our international listeners, that is the largest hospital in Trinidad and Tobago, and I believe definitely in the English-speaking Caribbean, if not beyond. And it was a massive project
I
done.
think it's one of the largest complexes in medicine.
Yeah, and that was built
Between 81 and 85.
yeah, out of that first oil boom we had in the 70s. So that was one phase of our medical expansion of infrastructure, and you were part of that. Yes.
Well, we had 2 hospitals. They were old hospitals built in the colonial days. That's the San Fernando General, and the Spain General Hospital with a 5-block unit. Medical Sciences Company, former Prime Minister. I had to open the pediatric part of the hospital because when I was chairman of the Northwest Regional Health Authority, I moved the pediatric wards across to the Eric Williams Medical Sciences Complex. And then we evolved into becoming a University of the West Indies Trinidad aspect. We started the preclinical sciences in Trinidad in 1987. Then we had the first graduates in 93, 94. So the medical faculty in Trinidad now is about 30 years young, still, whereas the University of the West Indies medical faculty started in 1952, I believe, or 56, I might be mistaken, under the Royal
again,
Charter.
just to interject for our international listeners, the University of the West Indies is a unique university, and that is multinational. It's in different countries, different islands in the West Indies, which are separate countries: Jamaica, Barbados, Trinidad. The Jamaica had the medical facility, but then Dr. Gopi Singh was involved.
Yes, before in 1950s, they started there.
Yeah.
And but we had off campuses do clinical medicine in the different countries, Barbados and Trinidad. And then we opened up the one in Bahamas in 1999. There was a hospital, but then we became part of the medical school. Then Barbados has its own medical school now, but we have a common syllabus and a common examination amongst the 4 campuses of the University of the West Indies. And that's where I really began. I did my postgraduate work at the University of London in 3 hospitals: Hammersmith, Chelsea Hospital for Women, and Queen Charlotte Hospital, where the royal family went. And in 1982, I went up to Johns Hopkins University to do academic skills and reproductive medicine. In 1988, I came up with the Royal College of Physicians and Surgeons in Canada to do the gynecologic oncology part. I was the first non-Canadian to have been trained in the program in gynecologic oncology in Canada, in Toronto, in 1988. So when I came back, I basically did generally gynecologic oncology until today. I almost stopped all the obstetrics. But I became clinical dean in 1994. And we had to ensure that the medical faculty became self-sufficient. And then I was appointed associate professor level in 1993. And then when I worked in the hospital, what got me into politics, I said we were trying to help in the management of patients and improve our healthcare. But within the medical faculty, you're limited. You can't do as much as you would like to do. And so I decided that at some time I will want to be in a position so that I can assist. And that's when I was approached to join the politics. And I thought from a technical perspective, I will help in improving the healthcare, but you get drawn more and more into the politics. And this is where I began to serve as chairman of the 2 of 4 regional health authorities in Trinidad, which started in 1993. But I joined in 97. Then I was deputy chairman of the National Advisory Committee on Education. In same 97, I helped to formulate the National Training Agency with a number of my colleagues in 96, 97 as well. Then I was appointed as senator in 2001. Then we lost the election. We came back as a temporary senator and a full senator. And then I came back into the parliament as an elected member in 2007. And I served there for 13 years, once in opposition between 2007 to 2010 to 15 in government as Minister of Education. I also acted many times as Minister of Health. Mr. Pandey had appointed me Minister of Integrated Planning and Development in 2001 in the absence of John Humphrey. So the political sojourn has been long, but I retired from representative politics at the end of the last 11th Parliament in Trinidad. I served on the 7th, 8th, I skipped one, 10th and 11th Parliament in both Senate and in government. But my whole life really has been medicine. I really love the medicine. I taught over 3,000 young medical students. I would have been instrumental in training about 50 postgraduates. I wrote about 33 papers in international scientific refereed journals. I made about presentations in about 40 cities around the world, scientific presentations. And I contributed some chapters in medical textbooks. But this has been, and now I'm trying to put an overall aspect to see how we can improve medicine and education. These are my core technical abilities, medicine and education. Well, and so I look forward to continuing.
Yeah, that's really great. And both Dr. Elders and Dr. Gopi Singh, I mean, you come from, the rural backgrounds, very underserved compared to the rest of the population where, in Trinidad and in the United States. And both of you broke barriers, being the first in many fields. That's amazing. Now, Marcia, you also come from a rural background. Is that correct?
No, I'm a split personality. It's half correct. I happen to be born in Pennsylvania, and I was born 2 blocks from the U.S. Steel Tube Works in McKeesport near Pittsburgh. But the other side of the family, my father ran a dairy and bought from 600 dairy farmers in Pennsylvania and helped organize the first dairy farmer cooperative in the whole state. The day of my birth, 1943. So I remember that. I don't personally, but so I think infrastructure was my watchword when I was growing up, because in Pittsburgh, Pennsylvania, it was the home of steel at the time. I was born during the war, and it was full of smoke and full of production. And the same with the dairying. I know a lot about cows and dairy processing, and but infrastructure was all over. I didn't know anything else when I was young. The first commercial nuclear power plant was near me in Western Pennsylvania in 1956. And I took for granted many things like bridges. Pennsylvania has the largest number of bridges per unit area in the world, with all the river runoff. So I didn't know any better, and I was very interested in this. And also I came to know that at the same time internationally were these famous infrastructure commitments like Atoms for Peace. That was under Eisenhower politically, but it was non-party. And you had Food for Peace, and with sending food where needed. And you had, under Kennedy, the Alliance for Progress in the Americas. So all this made sense to me, but I think I could say the Vietnam War opened my eyes that there was a different outlook in the world that fostered wars and fostered conflicts, like we could say today, Syria and Yemen. This is wrong. But what happened is, I think at the time that also, that was in the 60s, I saw many of the people I looked up to, President Kennedy, Dr. Martin Luther King, Robert Kennedy, they were assassinated, Malcolm X. So I became very worried what was happening in the world. I happened to teach in England and in Australia. I was teaching economic geography and history, and along came, I saw that when it came to Vietnam, I heard Lyndon LaRouche, an American, say Indochina instead of war in Vietnam could be the Rice Bowl of Asia. And I knew that for a fact. I knew about agriculture. So when he said we should have an international development bank in 1975, I thought, well, that makes sense. And 1976, I was chairman of his run for president of the United States, and we put him on the ballot in 26 states. Enough that had we had the vote, we did have a big vote in the Dakotas, and you could win. So it was a serious policy challenge. So fast forward, I have been very committed to fight for infrastructure and the policy behind it, that everyone and every nation should have the physical and also cultural and scientific means for advancement. And I've been in some big fights. Dr. Elders, I was in the fight in Washington, D.C., that we should keep the District of Columbia General Hospital open. There was a financial crowd after the 1970s internationally that said free markets and floating currencies and this kind of financial policy should rule, not nation building with infrastructure. So Washington, D.C. General Hospital was was actually shut down. We fought against it. Many physicians, Dr. Walter Faget, I know many others, Dr. Seymour, who headed, this hospital had over 500 beds. It had a quarantine wing. It was full service and served Washington, D.C.'s constituency. Many poor had full service, and it was shut down. So that's what happened after the 1970s. There was a takedown, there was a ceasing of the infrastructure building. And I was interested early on, like even in the Caribbean, I didn't know much, but Eisenhower in 1956, they finished, for example, a dam in the island of Hispaniola and the Artibonite River, the Peligre Dam. And I thought then as a young person, that should be the way the world should go. And it turned out to be a big fight. And look where we are now with the pandemic. That's our fight now.
Wow, that's very interesting. Well, Dr. Elders, I want to ask you, it ties into what Marcia was saying about the Committee for the Coincidence of Opposites. You were a co-initiator of that. Can you explain how that happened and what it's about and what you all are advocating?
Well, the committee has really been working very hard. Probably it's more of the brainchild of Helga than, but the rest of us, she kind of the brainchild of forming the committee, but the rest of us have gotten together. We thought it was a great idea and we worked together. We feel very strongly that, we should have work, may all be from many different areas, many different backgrounds, but we need to work together to make sure that everybody, the world, has the things that are essential for life. We need to make sure that everybody has health care. We don't need a tertiary hospital everywhere, or we can do heart transplants, but we need to have the basic public health. We've got to make sure that everybody has food. If you don't have food, there's no way to be healthy. You can't be. I can't be worrying about taking care of your health, but we've got to have worried about education. You can't educate children if their stomach is growling, and if there's no food, we've got to make sure that we've got to make sure that we have food, clothing, and shelter. We've got to make sure we have clean drinking water. Yeah, and there are some of these things we're able to really put together and do fairly quickly. Others are far more complicated. You can't train a neurosurgeon overnight, but we can train a lot. We talked about training some of the community health workers, people that can work, young people who could work in the community and could really do things to make a great difference in the health of that community. They could do things like go take blood pressures, blood sugars, blood pressures, things that would really make a difference in keeping people healthy and making sure we knew who had food, that they knew about the best that they had to offer in terms of housing. And so that was kind of our idea is, we want everybody to have excellent, super health. We want them all to have good doctors and the best health possible, but we can't if we don't have the very basics. Well, we can make sure that they have the best that they can possibly have and that it's being used as effectively as it can be used.
Yeah, I'll tell you, in reading the news just over the past couple of days, that perspective, really, stood out to me more because in Africa, for example, and this ties in with some of the politics here in Trinidad and Tobago. In Africa right now, there are about 2 million vaccines or so that are about to be destroyed because they receive them from the COVAX facility, but they're about to achieve their expiry date. Some of it is from vaccine hesitancy, but some of it is they don't have the infrastructure to actually deliver the vaccines throughout their countries and whatnot. So that, so that is not just a matter of having medicines and vaccines to disseminate, but it's about having a health infrastructure in the countries. And I think that's exactly the type of thing what you're talking about, isn't it, Dr. Elders?
Absolutely. There are just certain basic things that's very basic, and we can try and make sure that it's there in every country. As I said, we don't have to be able to do heart transplants everywhere, but there's we need to be able to give the immunizations if we get there. We need to make sure that people know about it. And so we've got to make sure we educate the people there, educate our people, work on building up the very basic infrastructure to make sure that we can do what we can do and use what we can use and have the people there be able to do the things that they can do.
Excellent. And this brings us to Dr. Gopi Singh. I want to ask you because you were involved with the establishment of Mount Hope, which is a major hospital in the Caribbean here in Trinidad and Tobago. But then also, while you were cabinet minister and sometimes acting minister of health, you were part of the government that had this massive expansion of health facilities that have now become so important in the parallel health system in treating COVID patients. And you know, and there was even some resistance to that investment going on here. And to tie one more thing into what Dr. Elder's saying, she was saying, well, you know, maybe not everything can be done here. Although, you know, I have to have a story. When V.S. Naipaul was here sometime around 2008 or so, and we were talking, I mean, he was telling me the care he got in Trinidad blew him away because he said it's better than what he would have got in the UK. And he was very surprised when he grew up here in the 50s, how things changed by the 2000s. But the Children's Life Fund was a very important aspect of the government you served under, Dr. Gopi Singh, where there were some procedures that we could not provide locally, but there was a fund set up by the government to send children to those specialist institutions. And this was all part of this massive transformation of the health system, which when we bring in the politics, unfortunately, when the government changed, these things got scaled back. Could you elaborate on that for us?
Yes, certainly. Well, we had two general hospitals, Port of Spain and San Fernando, which served the North and Central. But with the erection of the Mount Hope Medical Complex, which is named the Eric Williams Medical Sciences Complex, it began a little transformation into more subspecialties of the Department of Medicine. And then it started with a medical school came on. And when you teach in a hospital, the standards improve from the time you begin to teach young doctors and postgraduates. And we have been very fortunate. We train more than about 300 doctors per year in the Caribbean. Barbados now doing some training. Jamaica, about 120 per year. And Trinidad had, over the last few years, about 150. We train students from outside of the Caribbean as well. And from some of the Caribbean countries, they go to us. But we have a parallel health system. One is public and one is private. And we have a number of district health facilities which service the district from different places in different parts of the country. And as you rightly said, with the construction of the Couva Hospital, and which we completed during Mrs. Bissessa's time as Prime Minister. And then the start of construction of the Point Forte Hospital and the Arima Hospital, these are outlying hospitals. This has improved the ability to capture the population in these areas.
And then also San Fernando Teaching Hospital as well, correct?
San Fernando Teaching Hospital. And also the construction of 1 or 2 additional district health facilities. So we open up the bed population by more than close to 1,000 beds during our period of time. We improve training for nurses. We improve training for paramedical. And so it was a training program concomitant with the medical personnel expand sector. We have about 10 private, smaller hospitals, but they do a number of advanced surgical procedures, and they help with so we have a system where, similar to England, where the state pays for the population that is unable to afford private health care. Some who can afford private health care go into the private institutions. But you have basically the same medical and nursing personnel that move across both. So the issue then is we did an analysis of the real problems facing the country. And the disease process is non-communicable disease, which is experienced across the world, of diabetes, hypertension, cardiovascular disease, and with strokes and heart attacks and so on, and also cancer. And we have in our country about 18,000 births per year, about 11 to 12,000 deaths, equal amount of men and women. And the leading cause of death in Trinidad is in men is heart disease and heart attacks, strokes, etc. And next is close to it is hypertension, and then cancer. And the commonest cause of death in women is cancer, and then the other things follow heart disease. So we have to continue to make an impact on the reduction of the non-communicable disease by the prevention and early diagnosis and treatment to prevent the major complications of these diabetes, hypertension. And what you do, you prevent things like kidney failure, you prevent heart attacks, you have to prevent strokes, you prevent blindness, you prevent amputations. And as Dr. Elder, who was a professor of pediatrics, she would understand that these are some imperatives that you have to work with to prevent the complications, because most of the beds in the hospitals are filled with patients with complications of these disease processes. And then cancer is another one where we have now moved ahead to get the necessary infrastructure, equipment, and so on to help diagnose the cancer in the earlier stage. And we have more and more doctors being trained now to help to manage these cancer patients, whether it's radiotherapy, chemotherapy, or general surgery, surgical oncology. So generally, I think we are at a good level. It could be improved. And I heard Dr. Elder mention the issue of teenage pregnancies and so on, which have reaped havoc with our social problems. And since 2007, I've been speaking about we need to get put a lid on that, because when the research came out from the Central Statistical Office, it showed more than about 2,500 teenage pregnancies per year. And when I was Minister of Education, we had the number of teenage pregnancies in the secondary schools. So we have to work from a social perspective to help to reduce that amount. We have to work in the health sector from a preventive aspect, and we have to work from an education sector to help to, as our colleagues mentioned, about educating the general population. But we have a high percentage of single mothers who are struggling to make ends meet and so on. And so this is where part of the difficulty comes in terms of the social aspect. And of course, now, within the last few years, there has been some massive unemployment, which give rise to many more problems as a result of the COVID.
Yeah, that's actually a fascinating statistic you gave. I didn't know about the teenage pregnancy and the education policy, how that contributed to halving it. We should definitely talk about that more in perhaps another episode. That's fascinating. But one thing I want you to comment on, Dr. Gopi Singh, and then I'll bring in Marcia on this, is that when you look at the expansion of our facilities, because there are limited bed spaces and so forth, and we see pictures in our press here in Trinidad and Tobago of people lying on the floors. This is way before COVID started. We were having these problems, and so the Eric Williams Medical Complex that we spoke about was done in 1981, and then after that the next major expansion waited until 2010. That's 30 years, and it needed a change of government, in fact. And in fact, that first Eric Williams Medical Science Complex was riddled with corruption, and it became a huge political issue with the amount of corruption involved in that. And then from 2010 to 2015, under the People's Partnership government led by Kamla Prasad Bisesa, who was our first female prime minister as well, we had this massive expansion. But then when the new government came in, they kept the hospital closed. And this is mind-boggling, why they would do that. And it's only when the COVID crisis hit that they eventually opened it up. They were talking about debt and debt to China. That was their excuse that they used that. And then actually a lot of the lack of investment in the 80s and 90s had to do with our economic situation, the downturn, how we went to the IMF, we had structural adjustment, and we stopped investing in infrastructure. So I'd like you to address that in the Trinidad context, and Marcia, I'd like you to address that in the international context about the lack of investment in infrastructure, very often because of structural adjustment policies. But Tim, tell us about the Trinidad situation.
Well, the physical infrastructure now, as you said, already got a boom with the People's Partnership Government in 2010. And these 3 new hospitals and 1 or 2 district health facilities have been as a result of the investment by the People's Partnership under Mrs. Bissessa as Prime Minister. And that boom, so that the present administration and the government is able to use these facilities now to help with the management of COVID patients. But in the health sector across the world, and more so in Trinidad, we need expertise in healthcare management. And this is what we need to find. And we're not finding the real personnel to move into hospitals and so on to help with the proper management. Trinidad experimented with something in 1997 under former Prime Minister, 1994, with the regional health authorities to create 4 regional health authorities in Trinidad and 1 in Tobago. But we followed the British pattern. But that has been outdated, and the British system has changed about 3 or 4 times subsequent to that. And we are still holding on to regional health authorities, which is not working properly, bad management, although health, as our colleagues know and Dr. Elder will know, is like a bottomless pit. The more money you pump into it, is the more fallout. And but the real issue is management. And I think with few exceptions, Trinidad and Tobago, unfortunately, with the 40-something years of one PNM governance, their time, they have never had a good minister of health to run the country properly as far as the health sector. So they were fiddling from administration to administration. And during our government, under Mr. Pandey and Mrs. Bissessa, we had ministers of health who knew the system, who knew about healthcare, and we were able to make some significant gains with it. But as you mentioned, when you make gains and a new administration come in, most of those gains are reversed. It happened in education, where when I was Minister of Education, the next government came in 2015, they reversed almost all the wonderful policies and programs for the benefit of our students.
They had built like 116 schools or something.
106 schools, and it was formidable. We had a laptop. We became one of the first countries in the world to have 1 laptop per child. We gave out about 97,000 laptops to teachers, to students.
And they just stopped all that.
They just stopped all of that. We had a nice program for continuous learning, continuous assessment program to move students from one school, a primary school, to a secondary school over a 3-year period. You assess the students, and that would have given rise to students participating in the education, not reaching standard 5, but 3 years before and moving on to greater things. So Trinidad and Tobago, we have a lot more work to do. We need proper management. We need a government that is committed to working and to improving standards all across. We had a formidable team in 2010 to 2015. We made significant advances in almost every discipline and every area under Mrs. Bissessa. She allowed her ministers to work competently and smartly, not necessarily, people say you work hard, but our government works smart, and we were able to achieve. So with this COVID now, there are a lot of weaknesses in the program. We did not get the amount of vaccines that we should have had by now. There are a number of areas that have to be closed. The gaps have to be closed. And so to prevent the amount of debts that are occurring now, we have to move smart and swift to stop that. Before I finish mine, I would like to ask Dr. Elder if I remember in the early 1990s under President Clinton, he had appointed a team under Mrs. Clinton to bring about a report on the health care in the United States, bearing in mind there were too many consultants and doctors at a higher level, and there were not enough general practitioners to look after the interests of the communities, as Dr. Elder has been speaking about. And she is a pioneer on that, as we heard a while ago. And that was what brought her to become Surgeon General. So I don't know what has happened to that, if Dr. Elder can give us some little understanding and appreciation of it.
Just a brief note, what we said, we had too many specialists and not enough generalists. And we need to focus on health. See, we've got in the United States, we've got the best sick care system in the world. Problem is, we don't have a health care system. And so, and a part of that, I think, is related to, as Dr. Copeland has been saying, is, that's related to leadership and to getting things and moving them, politics, leadership, policies. So I think, we really could if the world leaders, if we could come together, well, we could begin to really look at what we can do to keep people healthy, get all the billions of people and millions of people in the world to improve their health. And I always say, you can't keep ignorant people healthy. So we've got to educate people so they can know how to take care of their own health and knowing what to do about their own health. And so I think with that is, I'm saying that we can really look at we've done wonderful in research. We've done a lot of good things, but we've got to involve all of our people in making sure that everybody does what they can do to improve their own health. And then all of our nations are operating at their top capacity rather than, so I think that was what we talked about is we haven't done much, we haven't really made much progress in having more generalists, but all I can say is we've been working on it. We still have too many specialists, but that's our system of paying for medicine or paying for healthcare is really supports the specialists and not the generalists. It supports sick care and not healthcare.
Right. That's fascinating. You're bringing up issues of leadership. You're bringing up issues of economics in both contexts that are working at a global level. And this is maybe where I'd like to bring in Marcia as well, because, so we saw in the specific cases in Trinidad and then with the United States, how you have the political side of it, the leadership, the vision, and then the lack thereof as well, which has hurt us. But there's also the economic side. I know definitely for us during the structural adjustment period and our long recession in the 1980s, we stopped investing in roads, in schools, in hospitals, and all sorts of things. And it's only much later that we started. And this is not a unique experience to Trinidad and Tobago, is it? This is part of the whole sort of debt system, the IMF and this kind of thing. I think that's something you analyze quite a bit, isn't it, Marcia?
Yes, I think that it's almost like systematic evil, not just individual unfortunate corruption or limited leadership, which we know about. So that since about you could say we've had a world casino economy that's been specializing in the monetary system, in debt and adjustment and austerity, and not in infrastructure. So just a couple of things. in the mid 20th century, that we've referred to this 1946 United States Act called the Hospital Survey and Construction Act. And it was only 9 pages long, by the way. And it said for all 3,000 counties in the United States, whether it's Arkansas or Massachusetts, for the local residents, they should have a nasal unit in their hospital. They should have some beds. As Dr. Elder said, they didn't need brain surgery everywhere. But, and internationally, fast forward to today, the pandemic shows the principle involved in that. And Dr. Gopi Singh has described the buildup period in Trinidad and Tobago. That's what we should be having in all regions of the world. There is no other way to deal with this pandemic or the next outbreak. And there are initiatives, let me just throw in, that are in the right direction in the Caribbean. It impresses me what Cuba is doing in the research for vaccines. We've also had the political vaccine initiative where several Honduras mayors asked the president of El Salvador to please give us some vaccines that you are getting from China or anywhere. And this was done. Argentina and Mexico announced collaboration. They're going to be manufacturing vaccines. So the principle that Dr. Gopi Singh described of the University of the West Indies, or, you know, working together, building teaching and health centers, but doing what Dr. Elder says, the public health measures can work. So someone can come along and say, but you don't have the steel for the hospitals, you don't have, well, that's the point, isn't it? It presupposes we're also going to work together to restore genuine production again. And that's why I'm very glad to work with the Committee for the Coincidence of Opposites, that on the whole range, the immediate emergency delivery, including of food. We have 12 million people just in Haiti and Honduras and Guatemala and some of the displaced Venezuelans who need emergency food. And we can also, so we should do the emergency and then get back to work, building the water systems, the hospital systems for the longer term.
Right, great.
And
So
I forgot one thing.
Not a problem.
I should mention, I mentioned the enemy of the kind of extension of Wall Street that privatized hospitals. Dr. Elders knows about this. That's what happened. Beginning in that in the 1970s, 80s, public hospitals in the US were sold off for private profiteering. The insurance companies expanded to become the private arbiter of whether you get treated. So there's a lot of money involved, but it isn't paying for healthcare. But the latest is the green menace. There is a bubble saying Dr. Mark Carney, or not doctor, he's not a doctor at all.
Yeah.
There's a bubble, a green bubble that's being attempted by the monetarist financial system, Wall Street and City of London, that says, don't develop your resources or infrastructure. You go primitive and sell your carbon emission credits to a new carbon market we're creating. And the former head of the Bank of England, a stinker named Mark Carney, in April said that's what Africa should do as a continent. Do not develop your resources and your transport and everything, and sell carbon credits for not emitting anything. The Lancet Journal, the English famous medical journal, said that healthcare, if it's expanded throughout Africa and to billions more people in the world, will overheat the earth. We have to stop this greenness, craziness.
Yeah, I have to agree with those aspects, definitely. So Dr. Elders, I want to bring you in to now. Let's talk about this general topic we've been speaking about in the COVID crisis. Well, how has the COVID crisis exacerbated or magnified these issues?
But yeah, when we look and think at the COVID crisis, I think one of the things that we must be aware of, the COVID crisis has exposed the weak underbelly of all of the things we're talking about. All of these problems have been out there for a very long time. And now COVID has made us talk about them, especially in every country, not just underdeveloped, less developed countries, and made us realize that we can't heal ourselves without healing the rest of the world, or because otherwise it'll, it may just come back. So I feel that when we look and think, always when I think of leadership, I think of what I call the 5 C's of leadership. COVID has made us come together and begin to visualize that we've got a problem. It's made us realize that we've got to be consistent. We heard Dr. Tim talk about how governments would start and really develop something and have a good thing going on, and somebody else would come in and cut it off, and we start all over again. So we've got to, first of all, we've got to have a vision. We've got to be consistent in making it go. We've got to make sure that we're competent to get the job done. We've got to have competent people around to get the job done. And we've got to be committed to make it go on forever. And of course, we always have to have somebody who's in control. And so I think COVID has made us at least come together and think about it. And before, I think we were just all going in our separate directions, and we've not really thought about it. So I hope we take the lesson we've learned, take off our blinders, get 20/20 vision, and start looking at what can we do to improve the health of the world, realizing we aren't going to improve our own health until we improve, and everybody knows how to prevent the crisis that we get into.
Wow, I love that. And I love those 5 C's. They're really, really great summary of that. How about you, Dr. Gopi Singh? In all the discussion we've had, how has the COVID crisis exacerbated or illustrated this from your perspective?
Well, the first issue really is it's a viral infection that has swept the world. The world leaders and WHO are still trying to grapple with the etiology or the causative factor.
Mm-hmm.
And until that is not known, we stand a chance of having repeat viral infections from the SARS, the MERS, to the COVID-19, to what else is coming subsequent. As the common cold virus mutates, and you have to get vaccine almost every 2 years, a new vaccine. What is going to happen if this virus continues to mutate? And you have to get vaccine for 7 billion people around the world. And I hope the scientists come up with an answer to that. And I see that there are companies now looking at the nasal spray to offset the massive cost and the massive problems associated with the production of the vaccine and the administration of the vaccine across the globe. So there are basic underlying issues which we have to solve in terms of the prevention of this disease coming forward, or what was the etiology or causative factor for this virus, we still haven't found out. And how do you work to prevent something like this happening? As a young doctor in the 1970s and early 80s, we saw the emergence of the HIV virus. And now 19 and 21, 40 years later, we have not found a vaccine for the HIV virus. So we here focus, but HIV has killed a significant amount of people around the world. But the medical science has brought on new drugs and pharmaceuticals to help with that and to prevent demise. So some people could live a normal life with the pharmaceuticals. Now, where are we with COVID? So we could have all the infrastructure, all the money, and we could want to vaccinate the entire population to bring herd immunity and so on. But you have to think about the future and the emergence of continued emergence of the, well, some people describe it as variants, but I say it's the mutation of the virus in itself, which keeps on mutating, because it did mutate from SARS to MERS to this COVID-19. But the virologists and the infectious disease people and around the globe will have to grapple with that, because we are a country that will depend on the international work that has to be done. And the Surgeon General will probably be looking at that, and Marcia as well, from a perspective of the economics.
Yeah.
This is
and also, I guess,
costly.
and what you're talking about is the science and the research and development, which is, it has to be part of, it can't only be delivery, but has to be thinking part of it, the anticipation part. We've reached the end of the program, unfortunately, but before I give a closing remark, let me just ask Marcia quickly, is there anything you would like to add? I think doctors, elders, and Gopi Singh gave a nice sum.
I think they said it all, and this should be the agenda for us pushing the major power leaders, like China and Russia are already getting together. But we set the agenda, and it should be just what was described. It's kind of an Apollo program that we had 52 years ago. We can do this.
Excellent, excellent. Well, I want to thank you all so much for this fascinating and interesting discussion. It's really been a pleasure having you on the program.
Thank you, Phil.
Thank you.
That's it for this week's episode of A Story Club Global Politics and Cultures, brought to you by Bulletproof Podcast Formula. We were talking with our guests, Dr. Joyce and Elders, Dr. Tim Gopi Singh, and Marcia Mary Baker, on the topic, Building Global and National Health Infrastructure in the Wake of COVID. I'd also like to thank you, our audience, for watching and listening. Please join us again next week, and in the meanwhile, like, share, and tell your friends about us. Thanks again, and see you next week.